All right, so now comes the kind of exciting bit of the morning. We're going to have a panel question and answers, answering questions or whatever. We have our expert recruiters, nurse managers, educators all up here. Before I get them all to introduce themselves, we've got a few more than we had anticipated, but we know we're getting lots of questions. So we want to make sure we have the depth of all the different health services with us to answer all your questions. What we will do, first of all, is it's 40 minutes. What we're going to do is start off with questions from the floor for 10 minutes, and then we'll move 10 minutes to online. So all those people online, get your keyboards ready. And just listen to what questions are being asked, because obviously we don't want to keep repeating the same question. And if you can also direct your question to the relevant person on the panel. Okay, what I'm holding here with me is what we call the speaker catch box. All right, so there's a few down there already. I'm going to throw it down to someone. When you get it, if you want to ask a question, just hold it and ask the question in it, okay? And then someone else can put their hand up, you can throw it over to them, okay? And they can answer the question, okay? So rather than me in my heels running around with, all the microphones, this is going to be a better idea than me falling over in the aisles. All right, so I'm gonna throw it. There we go. So I'm going to get everyone to introduce themselves, okay, and then we can start taking questions from the floor. Are they all working? No? Yeah, that's it. Yeah.
Hi everyone, my name's Wendy Milne. I'm the workforce manager for the Pilbara. So looking forward to hearing all your questions.
Hello, I'm Emily Davis. I'm the District Director of Nursing for and midwifery at West Pilbara. So I cover Karratha, Onslow and Roebourne.
Hello, I'm Jacody. I'm a new grad at Royal Perth Hospital in a geriatrics medical subacute surgical ward.
Hello, I'm Nadine Krokot. I'm the graduate nurse coordinator for Royal Perth Hospital.
Hello, I am Kendall Fairless. I am the graduate nurse coordinator for the Child and Adolescent Health Service Transition to Practice program.
Hi, Hi, can you hear? Oh, hi, I'm Charlene Latimer. I'm the nurse manager for staffing for North Metro for mental health.
Hi, I'm Nicola Ireland. I'm the nurse educator at King Eddie's and I'm running the peri-op course.
Hi, I'm Jodie Atkinson. I'm the graduate coordinator for midwifery at King Edward.
Hi, I'm the Philippa Rappington. I'm the regional clinical midwife consultant for the Wheat Bell.
Hi everyone, I'm Kellyanne Hahn. I'm the Executive Director of Nursing and Midwifery for the whole of WA Country Health. Thanks.
So we need some questions. Who's first? Who wants to be brave enough? There must be some questions out there. We haven't got this expert panel together just to sit there looking good. Thank you.
Hello?
Yes, so hold it right up close to you.
So I'm just wondering, what are the top 3 qualities you're looking for in a graduate registered nurse?
Who would you like to answer that?
Probably Kendall, if that's okay.
Oh, thank you so much for choosing me.
I think it will all come down to your application, so how you can sell yourself in your selection criteria. So what we're wanting to look for is you writing down the clinical experience and practice that you've had as an undergraduate student and how that transfers to each of our settings. So it doesn't necessarily matter if you haven't worked in a paediatric centre, all of that experience that you've gained as an undergrad student is still transferable. So really sell yourself in terms of your skills. We also want to know what your passions are. So if your passion is for paediatrics or for mental health or for country health, please try and incorporate that wherever you can into your application. And throughout that, you'll be able to demonstrate your confidence and competence to work as an RN within one of our grad programs.
Thank you.
Who's the next brave person?
I have one. Oh, that's enough. For you again, Kendall. How many different varieties of grad programs do you offer? I just got a bit confused during the speeches.
Yeah, it can be confusing. So during our presentation, we talked about all the different services that sit under Child and Adolescent Health Service. So currently we have 2 programs that are running. There's the CARS Transition to Practice program, and within that you'll have opportunities to work at Perth Children's Hospital, neonatology and Child and Adolescent Mental Health Service. The community health program is currently sitting separately because that's a whole 12-month program in community health. So you'll have opportunities to work in all areas, but you'll either be a part of the 12-month CARS program, which is PCH, neonates and mental health, or you can, if you're passionate about community health, we'll give you a dedicated supported program for 12 months also.
Okay, thank you. Anyone else?
So there's lots of changes happening at the moment in WA Health. Okay, so when you're looking to go into a transition to practice program, really go and chat with everyone out there, look online, because things are, changing, and there's lots of opportunities out there. Okay, who's next? Yes.
Could I just ask the same question as the First Lady to the Royal Perth people on the panel? What are the qualities that you're looking for in a graduate nurse?
I think Kendall answered that so well. We totally agree with that.
Same?
Yes, same. We want someone who is keen, wanting to work for our organization, of course. And as Kendall outlined that before, skills are transferable and learned on the job. So we really want you to be motivated and want to be a good nurse. Is that okay? Is that enough, Renat?
Maybe Jacody could tell us his experience in applying for Grad Connect for Royal Perth.
Yeah, so when the Grad Connect opens up, just put in your best resume and best selection criteria with all of those acronyms that you learn at university. So they want to see that you know about ISOBAR and the systematic approach. They want to see that you know how to apply A to E. They want to know about the ADPI process. So hitting the buzzwords will definitely give you an advantage. And then in your interview, they want to see your character shine through and that you can communicate well and become a part of the team. That you can blend into a team situation and fit in with them.
Thank
you. I was just wondering, if we do manage to get an interview, what can we expect in terms of questions and how, like what we should wear, everything?
Who would like to answer that?
Kendall, please.
Oh, Kendall, okay.
Thank you so much. So what you will expect is there'll be a panel that interviews you. So generally it's 3 people, normally the coordinator of your program, and then we'll collaborate with nurse managers and other educators across the hospital. So there'll be normally 3 people on the panel that will be asking you questions. When you arrive, we do give you some time to go through those questions so you can jot down some dot points, as well as bring in your selection criteria to help you answer those. It's perfectly fine if you read off that sheet. Sometimes you get nervous and need a little bit of direction or structure to your answer. That is fine. We'll also prompt you and ask you questions if we're wanting some more information out of you. So that's where we do really want to see your character, and this is where you get an opportunity to show your passion, express why you want to work within our organisation, and you just answer the question to the best of your ability. In terms of what you wear, I recommend, obviously you are presenting yourself in a professional manner, so wearing something that you don't necessarily have to wear your uniform or like your nursing uniform, but anything that shows you as a professional is definitely well received. Does that help answer your question, or anything else specific you want? No?
Hi, thank you all for being here. Don't press on it, I'm so confused.
No, just hold it to your face.
Oh, okay. I was wondering, are there any on-call requirements for the grad programs? I'm interested in Royal Perth, but obviously I think everyone would benefit from
Not at
everyone's
Royal
answer.
Perth, not during your transition to practice. You won't be called out.
Cool. Does anyone want this?
So the question was, are there any on-call requirements for graduate programs? And as far as I know, no.
Sometimes in rural facilities there is, definitely. I'm from the Pilbara, so we do have some capabilities of on-call, but it's very dependent.
If you're applying for a midwifery program and you're in a midwifery group practice, you will work in an on-call model, which is a 24 hours on-call model.
So for the Pilbara and the wheat belt, just in regards to accommodation, is there like on-sites there? Do you need to actually have something pre-organised before you go up there or down there?
So depending on which site you end up with, usually the graduates, one of the questions we ask you at interview is about who you're travelling with, pets, partners, those sorts of things, because it's dependent on what's available, on what we can offer you. Because it is in the northwest and because it does tend to be expensive, generally people do seek out that subsidised housing. If you're working over 0.8, which is what our grad programs are, there is subsidised housing, but it is depending on how many people you're bringing with you as to what we can actually provide for you. But we will get a housing request form completed with the information that you provide for us and submitted so we can get you allocated somewhere. And there's also incentives, I should say, for the Pilbara too, with district allowance and things like that, which is meant to contribute to the increased costs of living above the 26 parallel.
And just one other question in regards to the Pilbara. So obviously, like you're based in like either Karratha, Headland, etc. Do you have the opportunity to actually go out into the communities and stay out in the communities?
Yeah, absolutely. So the two biggest sites in the Pilbara are Karratha and Port Hedland, which Emily's West, which includes Karratha, Onslow and Roebourne. But the other parts of the Pilbara are Port Hedland and inland, which is Newman, Tom Price and Parabadoo. And there are a couple of smaller nursing post sites, but we don't tend to have grads there. So certainly if you apply there, you can say where your preferences are. They can't necessarily be accommodated, but we certainly try to get people where they are passionate about going.
And just on that, a few of the graduates are going out to smaller sites this year and last year, and there's been really fantastic feedback that they're learning lots and the support's been awesome, so it's definitely doable.
Just to add another country question, what are some of the unique things that you're going to get out of a country grad program compared to urban one?
I think we'll fight for this response. So definitely depending on where you're going, the thing that we will say is, depending if you're at one of the bigger sites, like we were talking with Port Hedland and Karratha, which are a little bit bigger, and you will go to a more, inpatients or theatre or ED or pop health. But if you're at the smaller sites, you won't get obviously the same kind of presentations that you would get if you're at a bigger site. What you do get is the diversity of everybody coming in. Most of those smaller sites have inpatient beds as well as ED beds, and so you're getting everything from neonates to palliative care. So it gives you a diversity and obviously gives you a different type of population, so you learn lots of different things. Does that answer your question? Yeah.
You also have the opportunity to become part of a community. Yeah. And if you think about the importance, particularly in our small sites, around the importance of a hospital or a health service and the status that you have in the community. So you have an opportunity to think about other life skills and other aspects, volunteer opportunities, all those types of things that come with being a respected member of a community and a smaller member of a community. So that comes with pros and cons, but it comes with amazing opportunities. And I think if that's something that can appeal to people around that sense of belonging and that sense of community, then there are a lot of different opportunities within the rural and remote setting that can offer you that. So have a think about that.
Just going to take one more question before we move to online. Don't forget, we'll come back to the forum here. So who's got a question?
I've got one. This is towards country health again. Just a question about any further education or postgrad opportunities in those areas.
We offer, obviously, you do your graduate program, which is supported by clinical facilitators and an educator. Obviously, there is opportunity for you to do postgraduate studies, and you're very much welcome to do that. And obviously, as an adult learner, you definitely can do that, and we welcome your skills that you obviously gain across that.
There's some amazing opportunities in mental health around formal, ongoing postgraduate education. So I think if that's an area that you're interested in, there's certainly from a mental health perspective, amazing opportunities in postgraduate education. We absolutely need to look at what that looks like. I'm not quite sure that we're perhaps there yet, but having an understanding and how you all can help be part of that future is really important. So perhaps not quite just yet, across the spectrum, but we need to look at how we diversify, work with the universities and look at what those postgraduate opportunities should look like, so that we look at what is that continuum of learning for our nursing and midwifery.
And those of you thinking about into the future postgraduate studies, through the Chief Nursing and Midwifery Office, we offer scholarships for postgraduate studies in different areas. So you can always, which helps to fund, obviously, the courses that you're going to go into. So, have a think about that. I know that you think, at the moment I just want to finish my studies, but that's always, as an adult learner, moving into the future, if there's any further studies that you'd like to undertake, that's always an option there to look at what support you'll be given financially. So we'll go to online questions. We've got Martina. Are graduate programs available for international students? If so, what are our chances? So I can answer this, Martina. Unfortunately, our Grad Connect process, international students are not eligible. You have to have a permanent residency, or you're an Australian citizen or a New Zealand citizen. So unfortunately, you wouldn't be eligible for the process. However, we do have there's other hospitals in private sector that may have a different eligibility criteria. So I'd encourage you to have a look at what those offerings are, but certainly not through the Grad Connect process for any transition to practice programs currently. Meg, question for Philippa and Jodie. Is Northern Midwifery Group Practice be an option for that elective? Do they take new grad midwives?
Just fighting Jodie off here a little bit. So Northam MGP, so for those who don't know, we have a midwifery group practice operating in Northam, and it's a low-risk midwifery model, and we are starting to take new graduates. We've got, fingers crossed, I've got my first graduate midwife starting in September, and certainly there's an option for people to choose that for next year too. Yeah.
And then Liz is asking, will King Eddie's be offering a mid-year intake for RNs in the peri-op program?
Yes, we will. That's the simple answer.
Yeah. Yes. Any other online questions? Oh, here we go. Sarah, WACS rural graduate program state there's a possibility for ED rotation. How can we confirm before selecting it?
I am a huge supporter of this one. So WACS Pilbara initiated a ED rotation program last year, and it has had great success. So you do 4 months in a bigger hospital. So we've started in Karratha and Port Hedland, and then you rotate 4 months into other smaller facilities, and it has had a great success rate. And I was saying to most of the people who I've spoken to that we have about an 80% retention rate after that, with people securing permanent jobs. So this has been a fantastic opportunity for people, and you've had a great range of, presentations, which has been fantastic.
And if you work in some of our smaller sites, then you absolutely automatically do ED, because they do everything.
So Rianne's asking, Jodie, with regards to acceptable uploaded supporting criteria, is it of benefit to include our online professional portfolio, which may include references gained along the journey?
Hi, Rianne. No, I wouldn't upload it. You're limited in the number of documents you can upload. So I would suggest that you actually bring that with you to your interview, and we can look at those references then.
And I just want to let everyone know, through the Grad Connect process, you can't upload a CV. I get a lot of questions saying, where do I upload my CV? We don't have an uploading capability for a CV. It's not that you don't need a CV, but the questions that we ask you through the Grad Connect online process are questions that you would be using in a CV anyway. Okay, so you still need a CV, but we don't ask you to upload it. So Chloe's asking, Jodie and Philippa, is Broome Hospital likely to be included in the country elective for King Eddie Midwife grad program, and where can we find more detailed information on the country MGP models for various locations, as there is minimal information on Grad Connect?
Hi, Chloe. There is the possibility of Broome Hospital being included as one of the country electives with King Edward. We are in discussions about that at present, and the elective locations will probably change every graduate program depending on the need of WACS for graduates.
So in terms of MGPs across WACS, the question, I'm not sure, sorry, I've lost who asked the question, but there are a number of programs across WACS, and I'm take on board that there's actually minimal information, so we need to address that, because obviously midwifery group practices are the way of the future for midwifery, and but currently there are MGP offering grad programs in Broome, Northam, Narrogin, Bunbury. I think that's it off the top of my head. Kanama's just starting, so that maybe for next year they'll be offering a grad program, but there are grad programs in WACS within MGPs.
When you go onto the Grad Connect website and you go into the participating sites, that will then have a link to the health service. So there's no actual information on the Grad Connect webpage on specific programs or health services. It will provide you to a link to those health services to get that information. Okay.
Sorry, can I just also say that obviously if anybody's got any particular questions around WACS and GPs, I'm more than happy to point them in the right direction, even if it's not within my wheat belt area. Certainly can put anybody in contact with the midwifery managers of the region.
Great.
Yeah.
Steph, another question for Kendall. Are there any positions available in CARS for enrolled nurse graduates? We don't get a placement in the area, but I'm still very interested.
Hi, Steph. Currently, we are not offering an enrolled nurse graduate program, in saying that we still employ enrolled nurses within CARS, so there are definitely opportunities to work within our organisation. We do have a recruitment pool that is advertised through Jobs WA for enrolled nurses, and if you're successful to that pool, we will offer a supportive transition program in paediatrics for you, so you get supported orientation and induction, and then support in your ward areas. And we do also have our COVID vaccination clinic currently that has enrolled nurse placements, so if you're wanting to gain some clinical experience, that's another area that you could work in. So we don't offer a grad program, but definitely employment opportunities for enrolled nurses at CARS.
So Sarah and Cara have similar questions about a written reference for Grad Connect, as well as their contact details, or do you get a written reference, or do you just have someone to contact? So there's no ability in Grad Connect to upload a written reference. What you'll need to have is the contact details of your referee, and know that time frame that I had talked about before, when the interviews will take place, and let your referees know that they may be called, okay? Because it will be, they'll be called, or they will be emailed to fill out either a referee form or to talk to someone on the phone, okay? And we'll take these last two before then we move to the floor again. So for Royal Perth, Bentley, Ella's asking, will you take graduates during the middle of the year for the July applicants?
Hi Ella, we will be looking at this for next year, yes, for our 2022 program.
And for Jacody, what are the common struggles that every graduate goes through during their grad year, and how do you manage it?
There are many struggles. A big one is learning how to transition into full-time work after the chilled out uni life. No longer will you be sleeping in or going to the beach instead of a lecture. So one thing is getting that work-life balance and making sure that you still have time for your friends and family, sport and exercise, because your mental health is very important. But also making sure that you put your extracurriculars aside, if you have any, just for a little while, and really focusing on learning the skills you need to at the job. Apart from that, it's just keeping your uniform clean with salt, and that's it.
So there's just a couple of questions that I'd like to address. Will this forum be run every year? Look, we don't know. I hope so. It's up to you guys to give the feedback that this is a really valuable opportunity, because obviously it's a significant investment, okay, to run one of these days. So we would really appreciate your feedback, and you will get an email from me to participate in a SurveyMonkey, so then I can push it up through the powers that be. So hopefully And Verity's asking, if I finish semester 7 in November, am I correct in saying I would apply in July? Yes. So if you're finishing at the end of the year, you would be applying in this July process, because this process, July process, will be recruiting for positions from January to July next year. Okay. So we'll start taking questions from the floor. Who's next? Who's got the box?
Hey, I'd like to ask a question towards mental health and PCH. I just want to ask about what's like the mental work. I mean, the men's workforce around it. Like how many of the percentage of the workforce is male, and what particular wards or specialties are they generally in?
Was this for mental health or for Perth Children's?
Both of them. Sorry.
I'll speak for Perth Children's. Well, there's no percentage of male nurses that we have. We are very encouraging of both female and male, so they're not allocated out in a certain percentage. And often the male nurses work across all of the ward areas at Perth Children's, so not only mental health, but ED, your general medical and surgical wards. It's a variety. They work anywhere that they have the interest.
Just for mental health, within our service, we have a pretty good ratio. There are a lot of male nurses around. I think I actually read something recently that in Australia it's about 37%, don't quote me on that, something like that for mental health. So, yeah, you'll be in good company.
Thank you.
Hi. Oh, that's really loud. I'm so sorry. This question is for Dakoti or anyone who would like to answer. Could you just paint us a picture of your first day as a grad nurse, and if there is anything you wish you'd known, or if there was one thing you'd do differently?
So your first 2 days actually of your grad program will be supernumerary. So you get to just follow around the nurses on the floor, get used to the routines, ask for advice and find out where everything is. But your first day actually working is a cyclone of new information. Everything happens so quickly. You're going to be really putting your time management and prioritisation skills to the test. But you're not really expected so much to be just dropped in the deep end and there you go. You're on your own. As a grad, you get so much support and people are always checking in on you. And the nurses around you on the team, they understand that you're a new grad and that you do need a bit more help. So it is a very overwhelming experience, but also you have a sense of comfort in knowing that you've got so much support around you.
Can you hear me? Okay.
Yep.
Hi, so I'm interested in specialising in mental health, and my question is for the Royal Perth and the country guys. So I just wanted a bit of clarification on if any of the grad programs that you provide kind of have a mental health rotation as well as kind of other areas, just to get that comprehensive knowledge and skills before specialising.
From a WACS perspective, so certainly in my region we offer a community mental health rotation, but you can also then go do inpatients on a ward, so you get multiple opportunities there.
From the Royal Perth Bentley Group, we offer a 12-month graduate mental health program, only mental health rotation, and that is in collaboration also for a certificate with the Notre Dame University. You can also apply for Bentley for their comprehensive program, which gives you 6 months in mental health and 6 months on a general ward. We have small amounts available at Royal Perth, so your better option would be Bentley. If you're really keen on mental health, there are lots of different availability for mental health patients.
Thank you.
So my question is mainly towards the WACS ladies. So I have 2 questions. One of them is with support with graduates. How do you think it compares doing a metro versus a rural, and the support for actual graduates in those programs? Like, would they receive the same support, maybe a bit less because it is rural? And then my second question is for postgrad, if you're going rural, what are I think the challenges or something around that, and maybe having to move back to the city to maybe do a postgrad and then going back, and kind of along that kind of line.
So from a support perspective, I guess one of the things that we're exploring, because you're absolutely right, that is one of the challenges. So we've got a brand new initiative that's literally just started this year, which we're calling Backup, and that's a virtual. So we've got some nurses who have a variety of skills. So we've got an ICU nurse, we've got an ED nurse, we've got a rural nurse, and they're sitting with our command centre. So a lot of innovation in country health at the moment is around that virtual space. So they are sitting in at Royal Perth, actually. And providing that in-reach support. So that's that's not going to be the be-all and end-all, because you have to have online, you have to have support where you are. So, but it's looking at what are the innovations and the opportunities that we have. So I think there's opportunities from that perspective. So remembering that your registered nurse and clinical nurse have that role in support as well. So it's not only about having that dedicated support, it's about the supports around you and how you seek support. So how are you going to seek your own support? What's your network going to be? And having a think about what that looks like for all of you. So whether or not you're in a busy ward that where it's about discharges out by 10 and how you're getting the next person in and what's going on in the emergency department and all those challenges, versus you're in Roban, so where you might only get 10 or 15 presentations a day. So how do you? What are your internal coping mechanisms, and how is your support network going to work within your colleagues, within the people around you, outside of work? So what motivates you, and what supports you need to be able to progress your career, I guess. In relation to postgraduate studies, I think you don't have to come back to the city anymore. So there's online opportunities, and people seek those opportunities for a whole raft of reasons. So it's that balance again between online opportunities versus how you get that support. So there's definitely opportunities.
And I'm just going to add a little bit more there. I'm sorry, I'm not selling wax completely. I'm selling my region, which is the Pilbara. We definitely have introduced more face-to-face training. So we've got clinical facilitators that are based in emergency, and we also have clinical facilitators on the ward and in midwifery. So you've got that face-to-face, and we're very much recommending that we buddy you up with someone, so that can be your phone a friend. And we all need one of them in our career, regardless if you're a beginner practitioner or you're at the end of your career. You need that person you can bounce ideas off and to know that you're sane, when you're having a bad day. And just one piece of advice that I can give you: when you are a graduate and you go to your grad orientation, you are going to make friends with those grads for the rest of your life, and they will be the people that you call upon when you're having a bad day, and they'll probably be able to give you some expert advice on your next rotation. So seriously, get to know them and prepare to go to a lot of weddings with them.
There was a question
Can
down
I,
there.
sorry, can I just add to the question in regard to the postgraduate? From my role, not necessarily for grad, but we've got a lot of, are retaining a lot of our grads, and so I get a lot of contact and see a lot of CVs from people finishing their graduate year and looking for other locations within the Pilbara. I can't tell you how many of them on there have got down that they've enrolled for a postgraduate following them completing their grad year because they've found what it is that they love to do. So do what makes you happy, makes your heart sing, not necessarily what you think is the right thing to do for your career. Do what is good for your career.
Okay. And then we'll move on to online questions. Yeah.
Oh, okay. There's a couple of people that had questions. Okay. I guess my question is more for Jacody. What is, I guess, what is the, struggles about adjusting to, life working, and how do you best, where do you go to find support, to improve practice and your confidence and competency And I guess like when you kind of started clicking or it didn't become as stressful and overwhelming. Does that even happen? I don't know.
So for me personally, this has, you do see your progression through the months. So I'm 3 months into my grad program, and it's only in the last week or two when I've started to feel like I'm having some good days here where, I'm getting everything done on time, I've had a lunch break, and it's all going sort of to plan. In terms of finding support, so at RPH, there's no lack of support whatsoever. Anyone you go to, whether it's people you work with or your SDN, sometimes Nadine will give you a hand. No, Nadine always gives you a hand. There's always someone you can turn to within the organisation. From a personal perspective, it really helps having a mentor and really good friends and family in your life that can point you in the right direction, because another one of the struggles is you get very, very tired, and sometimes you'll come home from work and just crash on the bed, and that's it. Does that answer it?
Yeah, thank you.
No worries.
Okay, so I'm just going to go to some online, and then we might come back if we've got time. So Kaylee's asking online, how realistic is it to get grad years at the main trauma hospital as an interstate applicant? I do know that WA nurses are prioritised, but I thought I'd ask.
Hi, is it Kelly?
Kaylee.
Kelly, yes, local nurses get priority. However, there's no harm in putting your application in, and if it meets the selection criteria, then you will get an interview, and then we'll see. So it's really dependent also where you're at Prague. We're looking at this. Yeah.
So Alina is an international student looking for opportunities in WACS. So what are my options?
Same as what we were talking before. So our preference from a legalities perspective, and we look at national, Australian citizens first. But
yeah. So unless you have Australian citizenship or permanent residency, then you're not eligible to apply through Grad Connect. However, then any other opportunities, then WACS will look at. I'll answer this from Natasha. What hospitals services go to second round preference applications? That's what everyone wants to know. They think it's kind of like a secret. It changes every year, okay? And there's no rhyme, no reason to it, but very few go to second round, and those few that do change every year. Okay, it depends upon the quality of the applications that are going to that particular preference. So if there's not a competitive pool, okay, that site will then go, I'm going to go to second round to see what the quality of applications are like in that pool. Okay, so it changes every year, but very few go to second round. Okay, but I'm not going to say no one, because we still do have sites that go to second round. Jody, do you take a certain number of dual or direct midwives, or is it whoever is best fit for the position?
It's the best candidates for the position. Put in a good selection criteria, do well at your interview, you'll get a graduate program. It's that simple. It doesn't come into whether you're postgrad, undergrad, dual degree. Okay? Just do your best on your application.
Sorry, can I just also add, or just put a myth to bed, that if you apply to WACS for a midwifery graduate program or a midwifery position, you don't necessarily have to be dual registered. I think sometimes there's a myth that you have to be both an RN and a midwife, and that isn't the case. So just to clear that up.
Great. And James is asking if I'm expected to graduate mid-year 2022, should I be applying in the March process next year? Yes. Okay, so that will be your process, because March will be the recruitment for positions starting from July to December 2022. Lexi, question for Jacody. How do you make the most of your learning opportunities throughout your grad program, and what have you found to be the most rewarding experience at Royal Perth?
Making the most of your learning opportunities. So every day you're getting new learning opportunities. Every day is very different, and you're thrown a lot of curveballs. the best way to make the most of those learning opportunities is, I find, to have someone with experience there with you, so they can explain to you how you went and what you can do better. And the next time comes around when you're given that learning opportunity, you can try and put their advice into practice and then reevaluate how you went. My most rewarding experience at RPH and my placement so far has been a number of times when family members are in, actually, and when they express their gratitude towards you for how you've helped their relative, their dad, their mum, and they really express it from the heart, and that's really quite touching. And I've had feelings where you might know you get those tingles and goosebumps. So, 2 or 3 times a week, that feeling is really, really special.
So this one's for Nadine. Can you please clarify, for the 2 6-month rotations, are any of the clinical areas mandatory, or are your rotations allocated solely on the preferences of specialty areas you submit?
Hi, Belinda. We have no mandatory areas. However, we will be looking, of course, for the allocation, depending on your application, on the quality, on your interview, of course, any of your preferences. And for us, it's also important where you had prac. So if you had a lot of medical prac and less surgical, I probably likely send you to a medical rotation first, and that depends for the other area as well, because we want you to be able to master the transition into practice fairly soon and uncomplicated, and with skills you have already learned in your prac and you feel more comfortable with. So there's nothing mandatory.
So I'll answer this. What if you haven't been given an opportunity for placement at a hospital you're applying for grad positions? Does it impact your chances? No, it doesn't. We all know that not everyone can have a placement in the exact ward at the exact hospital that you want. Okay, so you don't need to tailor necessarily your selection criteria questions to a specific area, because we know that you're not going to necessarily have had that placement. But I'll let Jodie also answer that as well. In terms of midwifery?
Exactly what Nat said. No, it makes no difference whatsoever. Of my graduates that I have currently, half of them have never had a placement at King Edward. So just put in your best application. Every applicant gets assessed exactly the same way, regardless of where you've done your placements.
And this is for Nadine. How will the graduates' performance be reviewed throughout the year? When and when?
Yes, so what we have done at Royal Perth a few years ago, we did an extensive review of our program, and we did a lot of changes, and we implemented tools to allow for early review of performance. So when you start with your orientation, you get already documents you complete with your preceptor or your SDN, and so there's a consistent feedback process in place. Then we expect you at a certain amount of time to set your objectives, so you review then where you are and where you're heading. Then we have the graduate rubric, where you discuss with your staff development nurse on the ward where you're performing very well and where areas you identify you need a bit more support. And then at the end of your program, you have your performance development review as well, and you can set objectives for the following year, or you just have a reflection on what is going on. We also ask you as part of the program to write some reflections. Reflective practice, well, I can't say that, is important also for good events. And sometimes, Jacody can probably speak from experience, when you have your first med call, that is very daunting, and often it's a feedback is very important, a briefing on the ward, but also your thoughts, putting down and what went really well or how you felt in a situation. So it's consistent. Yes.
Right. So our last online question, and then we'll have time for a couple more from the floor. Cara, would a psychology degree in addition to the nursing degree be seen as valuable? Who would like to answer that?
I'm guessing that's going to be in relation to mental health. So from our point of view, I would say so. I mean, it's obviously not necessary, but though the knowledge and skills you're going to gain through that degree are really going to be transferable into the mental health setting and would probably give you an edge as well. You'd be probably far better prepared in terms of your application and also interview, I would imagine, than other applicants. As everyone else has said, largely we just assessing the selection criteria. We're not able to consider all the other things, but I think that knowledge would be showing very much in the way that you write write your responses, and certainly at interview, the way that you respond to the questions, I would imagine that it will give you quite an edge, yes.
So questions from the floor.
Hello, my name's Jo. I just have a question regarding the perioperative program at King Eddie's. I was just wondering, would you be doing a anaesthetics rotation as well included in that? Because I'm very interested in the process and gaining experience in that area as well.
So an anaesthetic rotation isn't one of our formal rotations as part of the program, but you do get to go into the post-anaesthetic care unit where you will get those critical airway experience in there, and you will also be able to follow an anaesthetist through as well to get some hands-on experience with airway management.
Cool. I have a second question if no one else has another question, and it's just about infection control and management, and if there's any opportunities for graduates to actually get involved in that, especially with COVID at the moment as well, so for further career progression, so including WACS and Metro.
I think anyone that shows a specific interest to an area that they're passionate about is always encouraged. Yeah. And I think that you'll find that anywhere you go.
It's something we're exploring. So probably not quite there yet, but definitely something that we're exploring is what could that look like.
And in terms of peri-op at King Eddie's, we do have a working group for infection control and COVID-19, and we're always looking at getting our grads involved in that way as well.
Over here. Lady behind you. Oh.
Thank you. My first question is for you, Jacody. So, as a new grad in the ward, did you ever have a time where you felt like everything that you have learned, because mind you, you've come from a 3 years or 3.5 years degree, everything that you have learned, oh my goodness, I have to know it, there's an expectation. And then, you know, did you ever have that feeling on the ward to say, I need to know all of those things and bring them across? Because you would forget certain things. Is there an expectation? I guess that's my...
I didn't quite hear the last part of that. What was the last part of the question, sorry?
Sorry, I'll rephrase that again. So my question is, as a new grad on the ward, did you ever feel that there was an expectation on you to know things? Because you've come from a 3 years or 3.5 years degree and you've learned a whole lot throughout that time. And being on the floor as a new grad, was there ever an expectation, or did you ever feel like you had an expectation to know things, or, you know, yeah?
Yeah, okay, I understand that. So you've got a baseline when you first come in as a new grad, and that's determined by your selection criteria and your interview. When you're actually on the ward, you're expected to have that baseline. But from there, if you need any support, the staff and those around you, they know that that's a learning process. And as you go through and you get more experience through your grad program, those expectations will tag along with your level of experience.
I think that we as nurses don't know everything at any point during your career, and what's really important is that you know what your scope of practice is and you know where the resources are. So nobody can know everything, and if that's the expectation that you set on yourself, then you set yourself up to fail. So I'm the Executive Director of Nursing for Midwifery for the whole of WA Country Health. Let me tell you, I don't know everything. All right? So I think that it's relevant to your experience, and what is important is developing a network around you that you know where that you get the information from, and that comes from policy and that comes from the networks around you. It's an interdisciplinary thing. We don't work in silos of just nursing or just midwifery. So it's really important that you develop that network just as importantly, and recognise where your skill set is, where your strengths and weaknesses are. Use that reflective practice really well, not just I did this well, but you know, what are the bits that you, and innately for you, what are your strengths and weaknesses? So, you know, so that you know the groups of people and the things that you need to do to get around you, to develop you at any point in your career, not just in the first 3 months of nursing, but the whole way through your career. You're always learning. We're all always learning, and that's really important. So
just one last question. I'm mindful of the time. We've gone 10 minutes over, but I want to make sure that everyone gets their questions answered. Don't forget, we do have another question and answer session this afternoon. So yes.
So just a quick question. Before you were saying the selection criteria tips was like the acronyms of like ADPI and stuff, but what other tips is there that you could give us for selection criteria, maybe for Jacody and Kendall, maybe? Yeah.
One tip that I can give you selection criteria, was it? Or yeah. Okay. Use the processes that you've learnt at uni to answer the questions in a systematic way. So the STAR acronym was really helpful, where you state a situation that applies to the selection criteria question, the task, the action, and the result of that. I'd say just follow a systematic process where the person reading it can understand the progression of how you're answering the question.
Just to add to Jacody, definitely answer it in a structured or systematic way, but try and break it down as well and think of, absolutely want to see your clinical skills and experience as an undergrad student, but we also want your personal skills. This is a representation of you. So thinking of things like time management, prioritisation, being punctual to shifts, all of that type of things that's relevant to you, as well as your professional skills. So kind of break it down. If you've got examples and within your word limit, please try and incorporate those in there, because the more information that we can see of how you would actually manage the situation, the better we can get an idea of how you'd be in our grad program. Thank you.
I use what did you do, why did you do it, what was the outcome, and what would you do differently next time. And I think that just works for every level. That's your STAR acronym, that's everything. So what did you do, why did you do it, what was the outcome, what would you do differently next time. Simple as that.
And just to let everyone know, everyone's always shuddering around, selection criteria. We have actually now put the selection criteria on the website before Grad Connect the process actually opens. So they are up. They are the same questions. There's no secret. Okay, we're not trying to make it tricky for anyone. So you can actually go on now, have a look at the selection criteria questions, and start, penning some of your examples. So, but by the time you get to July 5th, those of you who are eligible to apply, you've got really good selection criteria examples. Okay. So thank you. We resume back at 1 o'clock for another Grad Connect presentations. Go and say hello to everyone. Ask the questions that you need.